Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Precocious puberty, precocious puberty. Precocious puberty is of two types. One, we have central or true precocious puberty. Second, peripheral precocious puberty. Central or true precocious puberty include there is premature activation of hypothalamo pituitary ovarian axis. There can be increased LH and increased FSH, which are diagnostic. There can be increased estrogen is seen in central precocious puberty. In central precocious puberty, due to premature activation of hypothalamo pituitary ovarian axis, there is increased luteinizing hormone, increased follicle stimulating hormone, and increased estrogen. Due to increased estrogen, puberty is always isosexual. The causes of central or true precocious puberty are 90% of the cases it is idiopathic and 10% of the cases occurs due to a brain tumor or hamartoma of tuber cinerarium. So in such case, always we should do an MRI in the brain. Peripheral precocious puberty. If there is peripheral precocious puberty, mainly occurs due to exogenous production of estrogen, or here there will be isolated increase in estrogen and androgen, and because of the increased estrogen and androgen, there occurs negative feedback of luteinizing hormone and follicle stimulating hormone. So as a result, there will be decreased luteinizing hormone and decreased follicle stimulating hormone. So, if peripheral precocious puberty is due to increased estrogen, then it is isosexual peripheral precocious puberty. If it is due to increased androgen, then it is heterosexual peripheral precocious puberty. The causes of peripheral precocious puberty include increased estrogen, which is seen in granulosa cell tumor, hypothyroidism, that is alpha subunit is similar to luteinizing hormone and follicle stimulating hormone, or McCune-Albright syndrome. Increased androgen is seen in Sertoli Leydig cell tumor, which is androgen secreting tumor of ovary, or congenital adrenal hyperplasia. So these are the causes of increased androgen leading to peripheral precocious puberty.
thank you and thank you for watching.